All right, thanks for joining us again. My name is Benjamin Turner. I'm behavioral health advocate. We're sitting down at the Lightning Step couch with Jodi Russo-Bailey and Shawna Martin with Virtual Hope Corporation. Jodi Russo-Bailey is the CEO and founder, and Shawna is the Chief Clinical Officer. Thanks for joining us today.
Thank you for having us.
Absolutely, absolutely. Jodi, can you tell us just a little bit about Virtual Hope and how you founded this organization?
Sure. So for a little over 20 years, I filled the space in substance abuse and mental health as an administrator, overseeing inpatient, outpatient facilities. Over the course of that time, I came to recognize that families are somewhat underserved. And what I mean by that is they're often left to pick up pieces. They don't know how to navigate. How do you love somebody through substance abuse and co-occurring mental health condition? And I stepped aside from the corporate world and I decided to write a book. It's called I Am the Other Side of Addiction, Breaking Family Chains. And what I came to recognize is as I was writing this book, I wanted to do more than just tell my story. Yes, I'm giving permission for others to, hey, open up and tell their story. But I realized we need to help heal the entire family unit because if we don't do that, it's just a vicious cycle. So I called Shawna. We had been colleagues for many years and friends, and she's an amazing clinician. And I said, hey, I have this idea, and I pitched it to her, and she was like, I'm in, let's do it.
Awesome.
And so, Shawna, if you want to talk a little bit about
Yeah.
what we created.
Right.
Yeah.
So we do all, it's a virtual platform
Okay.
providing life coaching to family members and friends of those affected by substance abuse and mental health or both. So it allows us to meet the clients where they are at that time. They don't have to worry about getting out, finding a babysitter, finding transportation. We come to their in their home, and like she said, the family members have kind of been left behind. So we want to make sure that whether they're dealing with a overdose of a loved one, or they recently got custody of their grandkids because their children aren't able to take care of them anymore. So we've created a curriculum-based life coaching program. So every client, regardless of who their life coach is on our platform, they're going to get pretty much the same program working, and we make them work. We give them homework. We give them worksheets. We ask those tough questions, and we can pull in their experience with either substance abuse or mental health and where they are right now and kind of cater what they need in life coaching.
That's beautiful. That is an amazing platform that you guys have. And how nice to have a friend in the industry that you guys can go into this together.
It's great.
Absolutely. So, what are some of the access barriers that you found for families?
Yeah. So, um, being in the industry for me, working with multiple families over the years, there's no real coverage, right? The insurance doesn't really pay for life coaching for families that are dealing with this. So that was one of the barriers that I often found. We are limited to provide the services for families when we have a patient who's inpatient or outpatient because it all determines on what that patient allows you to do.
Absolutely.
And so that's a huge barrier. And for many reasons, a patient will be limited on the release of information or what they're willing to share with their family. And so I often just found, sometimes often it was too late,
Yeah.
that families are like, what could I have done different?
Absolutely.
How do I stay healthy?
Yeah.
How do I not end up in divorce? How do I not drain my bank account? How do I not take out on my other children what my one child is going through? So many different things that we
don't
address.
have to worry about that identified patient, right?
Yeah.
We don't have to worry about the logistics of that, and we can help anyone that says, hey, I need help.
Yeah. And it's okay to need help.
Yeah.
And one of the ways we do that, Ben, is each individual person who signs up gets an assessment. So they're given, the family member is given an assessment
Very
that
similar to
allows
the
us.
patient would be when
Yeah.
they're being admitted. That's amazing.
Yeah, so we
You know,
kind of took it.
Yeah, it's really important to remember that substance use disorder doesn't end with the patient. It affects
It's a family
affects the
disease.
family, affects the community,
Yeah.
and it's hard to provide the support necessary if you're not addressing that full circle of environment that that patient is in.
Absolutely.
And what's the name of that book you wrote again?
It's called I Am the Other Side of Addiction, Breaking Family Chains.
Awesome.
Yeah.
Thank you for throwing that back out there.
Yeah.
I want to thank you for joining us here on the Lightning Step Couch.
you.
Again, this is Jodi Russo-Bailey, the CEO and founder of Virtual Hope Corporation, and Shawna Martin, the Chief Clinical Officer. Thank you so much, ladies, for joining us.
Thank you for having
Yeah,
us. Thank you. Our
absolutely.
pleasure.
Thank you.